Welcome, everybody. Welcome to Fraternity Foodie. This is Mike Eilon with Greek University, and welcome to episode number 30. We have a big treat for all of the listeners out there today. Today, we have with us Dr. Louis Profeta. He is a brand new speaker to Greek University, but he's also an ER doctor with tons of experience in speaking to fraternity and sorority members all over the country. So welcome, Dr. Profeta.
Thank you, Mike. Thank you for having me.
It's great to have you on board. Let's get right into the questions because I just find you so fascinating and everybody needs to learn so much about you. You received your MD from Indiana University in Bloomington. So what advice do you have for any college students out there that might be thinking about a career as a doctor today?
Go into banking. Go into real estate. Run, Forrest, run.
So why do you say that?
Medicine is wonderful. It's beautiful. It's an incredible journey, but it's a tough thing. I mean, it's not for the faint of heart. It takes an incredible amount of hard work and dedication and sleepless nights and frustrations. But if you can tough it out, it's an incredibly wonderful profession. So yeah, I encourage anybody to do it.
Excellent advice. And I know you've spent the last 26 years as an emergency physician at St. Vincent Hospital of Indianapolis. You've treated more than 60,000 patients in your career. And in your book, you actually, the patient in room 9 says he's God. It seems to me that you show a side of an ER doctor that's full of empathy for your patients. You're somebody who honors humanity. You're somebody who has a lot of respect for your elders. And I think you also show a lot of dignity for end-of-life decisions, end-of-life choices. So as we care for our parents or our grandparents who are aging, what types of things do you think that we should be talking to them about well before they get to that stage of life?
Well, I mean, first we need to be talking to them. I mean, that's one of the biggest problems, I think, in society today, especially when it comes to caring for the elderly, is that we've sort of marginalized them. We're awful busy with ourselves. We're doing travel sports. We're doing everything but spending time with our grandparents or elderly parents even. And we need to reconnect. And we need to put down the phones. We need to start having Sunday dinners and Friday night dinners at our grandparents' house and our parents' house. We need to pull them back into the fold. We have a tremendous breakdown of the nuclear family in America, and we need to recapture that. So first, we need to start talking to them. We need to bring them into our world. We need to have these conversations so that they know that we care about them, that we want them to be part of our lives. We need to make them a part of our lives. And then we have to have talks with them about what their dreams are, especially the waning years of their lives. How do they want to spend, especially the last 5 years of their lives? Do they want to be at home? Do they want to be in assisted living? Do they want to be on dialysis? To have these discussions. So those are, I think, issues that we have to have. We have to have these discussions about, how they want to spend their waxing days and their waning, hours of their lives. And, whether it's to be comfortable. Some people want to see every single sunset, no matter how painful it is. But some people don't want to fight that hard. So we have to know them. We have to respect them, and we have to have these open, honest discussions.
I think that's great. I think we should be talking to them about things like power of attorney. We should be talking to them about things like wills and, what do they want for their funerals? I know that's really an uncomfortable situation, but I think that that's a talk that we owe to them.
Yeah, but we also have to have talks about how do we make pickles? Can you tell me what Elvis was like? Can you tell me about what it was like to ration sugar in World War II? I mean, we have to have those talks too. Because you're not going to get to the talks about end-of-life care until you have talks about lifestyle and their own lives. We have to know them first.
Right. That's a really good point. Yeah, I absolutely 100% agree. Medical history, I think about family history, like you're talking about, all of those stories that are lost when the older generation passes. So, so much there, so much. All right. So I'm sure there have been many different scenarios that have played over in your mind over the years, but I was curious about something in particular. I know you got the Red Cross Certificate of Recognition, and you received that for medical assistance at a department store bombing. What happened in that situation?
Um, well, my lovely wife was with us too at the time. We were going into a Kmart department store back in, it would have been in 1989, I believe, 88 or 89, 1889. And a young girl picked up a bomb. There was a pipe bomb planted in a pump toothpaste container on the store shelf, and we had actually held the door for this young couple and their two little girls. And I happened to look down the aisle and saw this girl looking at something. Father was pushing a cart. I turned to say something to my wife, and there was an explosion. And this pipe bomb took this young girl's hand off, and caused her to lose an eye too. And it was set her clothes on fire. It was a horrible scene to be a part of. And my wife and I and an off-duty firefighter by the name of John Moriarty administered some first aid, put the flames out, and tried to stabilize the situation. And I was a medical student at that time. I didn't know anything about medicine, so it was a pretty scary moment. But things came out okay. And she's, interestingly enough, she is a physical therapist now in our hospital. She has her own children. So It's been how many years? 30 years, something like that.
That's an incredible story. It's amazing that she's alive and she's here with us.
She's an inspiration. She's an unbelievable individual.
Wow. Wow, that is incredible. Let's talk about some of your essays. Some of your essays have gone viral, and it seems like millions of people have read them all over the world. One of your essays, A Sunday Talk on Sex, Drugs, Drinking, and Dying, was particularly aimed at fraternity brothers on the topic of drugs, sexual assault, alcohol, and drugs. You also talk specifically about cocaine and heroin in that particular essay. So what should students do if they have a fraternity brother or a sorority sister that is using that kind of stuff in their chapter house?
Specifically cocaine and heroin?
Yeah.
That's what you're talking about?
Yeah.
Now, the conventional wisdom is to get them counseling or get them help. You know what my wisdom is? Kick them out, okay? In all seriousness. When you think about those two drugs, heroin and cocaine, as opposed to something like marijuana, okay? The recklessness and real disregard for self and for human lives and the norms of society are so out there that behavior is so dangerous, and that impulse, that lack of impulse control to be even able to go down that path of using a drug like cocaine and heroin is so extreme that you need to just cut ties immediately. I want you to think about this from a societal standpoint, especially when it comes to, again, heroin and cocaine. Mm-hmm. Think about the drug cartels and the violence and the murder and the torture that is involved in the sale and the distribution of those two drugs primarily. What they do to communities, what they do to families, what they do to countries. Look at the thousands of people that are murdered every year in Mexico in terms of dealing in those drugs. And you actually have somebody in your house that's helping to shore up that industry. I mean, if we're going to be this, quote, woke society that cares about each other, then we need to call people like that to the carpet and say, you know what, the fact that you're engaging in transactions with that kind of evil, we don't want you as part of our fraternity and sorority system. We need to move those people out. We have coddled some of this reckless behavior in a way that is so dangerous. It's so detrimental to the health and well-being of society that we need to say, hey, enough's enough. Move them out, encourage them to get help, maybe contact their parents, offer them, access to counseling, but they need to be away from us. And we need to move them out of our fraternities and sororities, let them find help, outside the Greek system.
Okay. The other essay that took on a life of its own was, I'll look at your Facebook profile before I tell your mother you're dead. And this was a really powerful one for me. You talk about looking for photos with mom and dad, so that way you, as the ER physician, know who to go to, who to talk to in the waiting room when their child is dead. So what should today's college student know about that interaction that you have with the parents that will make students think twice about their actions in college?
Well, the impetus behind that whole article is I had a situation where the young man was shot and killed. And I may have jumped to conclusion that he was involved in some behavior that he shouldn't have that got him shot. And after I pronounced him dead, his driver's license was laying on the counter, and he's about the same age as my kid, north side of Indianapolis. A lot of times my kids know these kids. They're Facebook friends or Snapchat or what have you, Instagram, and I sort of casually picked up his driver's license and said, I'll look at your Facebook profile before I tell your mother you're dead. And I flipped on Facebook to see if maybe my kids, might have even known this young man. And it was clear the minute I looked at his Facebook profile that I maybe had jumped to conclusions in terms of who this young man really was, what his life was really like. And that whole sort of casual exchange with the nurses about, yeah, hey, I'll look at your Facebook profile before I tell your mother you're dead, because we all do this. When they're dead on the cot, they're sort of lifeless. They are. I mean, there's no animation to them. They're still. But then when you look at them, through the lens of Facebook or some other social media platform, they actually develop a sense of life and purpose. And we tend to forget that. But what that article was about, it was about sort of getting a framework together for parents so that they could go to their child and say, this is how my life will look with you dead. This is the tragedy you will leave in your wake should you engage in reckless behavior that results in your death, whether it's drug or alcohol, whether it's reckless driving, whether it's just riding a bike without a helmet, whether it's texting while driving or not paying attention to the world around you. This is the problem that you leave. And it was my way of telling students especially to paint that picture of the incredible amount of despair and grief that the parents will go through. And I've done this, as I tell the students on college campuses, hundreds of times in terms of, young people ask me, and say, it's an ER doc, hey, what's the worst thing you've ever seen? And I'll tell them, the worst thing I've ever seen is the look on your mom and dad's face when I tell them you're dead. I mean, there's nothing worse than that. There's nothing worse than that on earth. So I wanted to paint this picture for young people to say, this is what this looks like. When I have to go into that quiet room and I have to kneel next to your mother who's pulling clumps of hair out of her head and bleeding down her scalp and screaming, and a father that is wailing in the most unbelievable despair, I want you to know that this is what this looks like. And if you don't care about your own life, if you engage in these reckless behaviors, you don't care about your own life, I want you to show you what this world looks like when you die. And when I have to go in and make this. And yeah, we're mad as healthcare providers in the emergency setting. When we see this happen, we get viscerally angry because the amount of despair that we're going to have to inflict on some other people in the coming moments. And then we have to go back and continue to work. Yeah, we're angry. We're angry at you for wasting such potential. And that's the kind of stuff that I tried to portray in that article. And boy, that thing resonated. I mean, it was one of the most read articles I think in the world on social media that year that I put it out last year. Mm-hmm. So, it works. I think it gives parents a platform, a way of telling their kids, hey, this is how I would feel. This is what my world would look like.
Yeah. Before we even met, I actually read that article, and I'm a parent to a 12-year-old and a 14-year-old. And that struck me hard as a parent. Boy.
Yeah.
I remember
reading. The world looked different once you had kids, didn't it? You always say, yeah, you know what love is, but you don't really know what it is until you have a child.
Amen. Well, that's definitely true. Your world changes. There's no question about that. So the North American Interfraternity Conference, they have these alcohol and drug policies that apply to all fraternities under the NIC, and they strictly prohibit drinking games for fraternities. And I know that you have a zero tolerance for these drinking games. So talk to us about why you feel this way, because I think it will help students understand it from your point of view if you explain why you're opposed to it.
Well, in all actuality, number one is drinking's not a game to begin with. I mean, America, and I'm going to be the first one to tell you, I love scotch. I love bourbon. Okay. I appreciate alcohol. It's got a rich tradition in America. It helped fund the Revolutionary War. I mean, it's the early days of currency in the United States. In some ways, it still is. But it's got an incredible rich tradition that should be embraced, just like wines in France and things like that. And it's not a tradition that you should be enjoying by punching a hole inside of a beer can or pouring the liquor down a plastic funnel. What it also is it's a form of coercion. It really is. It's a form of peer pressure for people that can't handle alcohol. And we shouldn't be encouraging people to drink alcohol when they don't feel like drinking or don't want to drink. And it is a form of sort of subtle coercion. I actually go a little farther when I talk to students. I don't even think that you should be pouring a drink for another person in a fraternity. Because if you're an upperclassman and you're pouring alcohol, here, let me give you a drink, let me get you a shot. Okay, you're essentially trying to welcome somebody in to your fold as opposed to just saying, hey, if you're thirsty, there's some beer over there. Okay, which is sort of a better response to that. So don't even pour them any alcohol. Let people police themselves. Let them get their own drink. Let them pour their own shots. Let them get their own glass of water. So, that's why I think that it is a form of subconscious coercion. People that aren't comfortable with drinking are more apt to do it in a game setting. And it doesn't allow people to become responsible drinkers on their own. It pushes them toward irresponsibility, and it's dangerous behavior, and it needs to stop.
That's a great explanation. I don't think anybody's heard it quite that way. So I think you give a lot of clarity to the point on why this particular policy is in place. I often see students on college campuses sharing prescription medications. It could be ADHD, it could be pain meds, it could be sleep aids, it could be antidepressants, it could even be anti-anxiety pills. So tell our audience, why is this practice of sharing prescription medications so dangerous from your perspective?
One of the things I'll ask some of the fraternities is I'll ask for a show of hands. How many of you have handguns that you leave, in your dorm room or in your fraternity rooms or your bedrooms? And everybody keeps their hand down. I said, well, why not? Well, they're not allowed. I said, well, why aren't they allowed? And you start to prod them about it. And more young people are going to die of prescription drug ingestions than handguns in the United States this year. Okay, yet they have no issue about leaving Vicodin out or Xanax out or Valium or Ativan or OxyContin or they need to be treated like a handgun. These are incredibly dangerous products. When somebody breaks into your house, they're looking for three things. They're looking for guns, they're looking for prescription drugs, and they're looking for money. Okay, so we cannot have that access within the fraternity system. Also, these drugs, it's a federal offense to transfer controlled substances from one person to another. And if somebody dies as a result of your prescription medication that you've given to a friend, guess who is going to testify on behalf of the prosecution? It's me. Okay, and I'll do everything in my power to help put you in jail should you do that. Okay, should you cause the death of another individual that you're friends with because you gave them your ADHD meds or you gave them your oxycodone or your Xanax or what have you. Okay, it takes an incredible amount of medical acumen to be able to safely prescribe and distribute these medications. And an 18 or 19-year-old college student does not have that acumen. Okay, leave it to us. All right, it's against the law. It's incredibly dangerous. Again, it's incredibly reckless. It's just as bad as leaving a loaded handgun out. And as far as I'm concerned, though, if you have to be on some of those pain medications, you shouldn't be even in the house to begin with. Again, that goes to the zero tolerance policy. If you're caught sharing a prescription pill, you're committing a crime. Okay, it's incredibly reckless and dangerous behavior. Should be kicked out immediately. Should be zero tolerance for that. And I'll tell you, they have. And it's one of those things when I start lecturing on campuses, I drive that home. I said, I will make sure that you go to jail. I'll do my best should you cause somebody else to be injured by sharing a prescription.
Right. So, thank you for saying that. I think that alone is going to save some lives out in college campuses today. Obviously, your discussions with college students, they are very emotional. They are vividly brutal. What kind of reactions do you see in the crowd, and what kind of conversations happen with the students following this kind of a presentation?
Well, I mean, some of them cry. I mean, you know, there's a certain part of the talk that I can literally take in, you know, 200-300 college students and shut them up into, you know, into deaf silence. I mean, it's incredible. But I think I bring an openness. I mean, I'm not judgmental. I'll tell them they're stupid when they're stupid. I don't hold anything back. They can ask me any personal questions they want. I'm not going to get mad at them. I have one goal in mind, and that is to keep kids from dying. I don't know if it's going to make a difference. I hope that one day when I meet my own maker, he'll say, hey, yeah, you make a difference. You made a difference. But what's amazing is how many emails I'll get from parents of these students and say, I don't know what you said to my kid, but my kid called me tonight and apologized for every stupid thing they've ever done. I've gotten emails as I've been in texted when I've been driving back from talks. So I think it resonates. You know, and I dispel a lot of myths. I give them safe drinking tips, safe use of marijuana tips, things like that. You know, because I want them healthy. I want them safe. I don't want them sexually assaulted. I don't want them losing their career over causing injury or harm to another person. I don't want them to become a victimizer either, because these medications or these drugs can make them not only a victim of a crime, but can also increase the likelihood that they become a victimizer. And so, you know, those are my goals. So the reception, especially among the fraternities, has been incredible. I mean, absolutely incredible. So, you know, I've been, you know, I found it, you know, very refreshing. I think that fraternities have been incredibly scapegoated in the American education system. And it's one of the things I tell them. I said, they are not the problem. Okay. In fact, when you have a group of men getting together in that kind of environment, in a non-judgmental open forum, that's what leadership is all about. And man, I love being a part of that, because these men really, you can tell that they want to address these issues. They want to learn. They want to be part of the solution. And as I said, let me tell you, I've yet to be invited by a group of dormitory students. I've yet to be invited by off-campus housing. It's the fraternities that are taking the lead on this. And damn it, they should be commended for their will and their activism and their desire to become better stewards of our country. These problems are deeper than just a bunch of young men getting together and partying in a fraternity house. These are societal problems that are just as prevalent in the trailer parks and in off-campus housings and on oil rigs and fishing boats and military bases as they are anywhere else. And we've scapegoated them for too long. They're showing incredible degree of being proactive in terms of addressing these problems head on. And I'm proud to be a part of it.
Yeah. I'm really happy that you said that. It makes me feel good as somebody who has dedicated my life to working with fraternity and sorority students. And I feel the same way. I picked this particular demographic because A, they are the leaders on every college campus. And B, I think they're the most able to bring change to the culture on college campuses. So I feel like it's a vehicle that we can actually change culture with.
And mind you, I wasn't in a fraternity. I knew nothing about this culture until, you know, my kid, I had two boys that were in one. One wasn't, but I didn't know anything about this, this world until I started talking to them, and you know, they sort of welcomed me in, and I'm privileged to be a part of it.
Yeah. Well, it's never too late. Never say never, because there are alumni initiations. So we can still initiate you. Yeah. We can still do this.
Take that whole thing.
Yeah, we can still do this. So it's never too late. I'm just saying that for our audience out there, because somebody's going to approach you and say you've done a lot of good work for fraternities. What do you say about being a member?
I'd love it. I would love it. I want to paddle and everything. One of those.
Just put it on the wall. Don't use it. All right. Now, you know, I also wanted to talk to you about mental health, because as an ER physician, I know you're seeing the emergence of some really complex mental health issues in the college setting. There also seems to be a shortage of counselors on many college campuses today. It seems that when I'm talking to college students, sometimes it's 3 or 4 weeks before they can get in to see a counselor at the university. So what should students do if they see one of their fraternity brothers or sorority sisters having a mental health issue?
You know, this is another thing I talk about quite a bit. And this is what is sort of beautiful and sad about college students at the same time. I love the sort of the idealism of the college student. It's incredibly refreshing. You know, young, the world's their oyster. They don't know real badness. Everything's roses. But the sad fact of the matter is that complicated mental health problems start to rear their heads in the late adolescent and early college ages. That's where we start to see major depression, bipolar disorder, schizophrenia. We start to see serious substance abuse issues. These issues are too complex for college students to manage. And God bless them. They want to help their friends. They want to help their roommates. They don't want to get them in trouble, et cetera, et cetera. But as I tell them, this is too complicated for you. Bring them to me. Bring them to us. We have 24-hour, almost every ER in America has 24-hour access to mental health and social services. Just bring them to us. Let us take that burden away from them. One of the things too is that we have to have discussions with parents early on before these kids get into the young people get into the fraternities. I hate using the term kids because these are men and women as far as I'm concerned. We have to have open discussions from the outset where we say, hey, listen, if we see behavior in you that is reckless, we're going to call your parents. We're going to call the people that love you the most, okay, and say, hey, we're worried about you. And we may insist that you take a leave of absence and know that we're doing that because we care about you. We want you healthy. If you refuse, then we're just going to kick you out, okay? Because if you have to sort of engage in that kind of tough love behavior. Again, to ask a bunch of 18, 19, 20-year-old people to try to navigate the world of complicated mental health issues is absolutely a disaster waiting to happen. And if the schools don't have adequate mental health counseling, then just bring them to us. We will get them set up with somebody. We have unbelievable resources within the emergency departments all across America. We do this all the time for everybody, everybody else who's, for the disenfranchised, people have no insurance. We will take care of it. So just bring them to us. We have,
That's great advice. I think that's something that our students are learning right now from you for the first time, that you have those services available at the hospital. I think, just heading to an ER or whatever to get help, I think is great, as opposed to waiting 3 or 4 weeks when who knows what could happen in that time.
Yeah, but what also happens though is so many of them are reluctant to do it because they're afraid that their parents will find out. Now we will protect them from we will not release medical records to anybody other than themselves. Mm-hmm. The trouble is though is that so many of these young people are on their parents' insurance, so that they get a copay, and then they call them up and they say, hey, were you sick? Were you in the emergency department? That's why you have to have these open, honest discussions with parents from the onset that essentially says, hey, listen, I may end up in the ER. If something were to happen, you need to give me a break and let me manage my own affairs. Okay, but please don't be mad if I drink too much and show up in the ER. Students will say, well, how much is an ER visit? And I always say it's cheaper than a casket. Okay, so we want you there. There's not a parent in America that would risk their child's life and well-being for the sake of a copay. So just come in, let us take care of it. Amen. Have those discussions with your parents early on, that this is how it's going to happen, that if we're worried about your son or your daughter, we're taking them to the ER. End of story.
Mm-hmm. Yeah, that's great advice. And you're having these types of honest conversations on college campuses all over the country. I'm wondering, since you are a parent, how does that shape your conversations with the students on college campuses?
Well, why do you think I'm having these conversations on college campuses? Because I'm a parent. Yeah. I mean, my oldest son, got sick when he was in college. He was a senior, was at Yeshiva University in New York, and he got cancer. He got leukemia. Mm-hmm. And his fraternity rallied and donated unbelievable amounts of blood to save my child's life. And I've seen the incredible outpouring of support from his fraternity members, and and for my other kids' friends. And and while he was going through chemo, I'd come back and work in Indianapolis periodically, and there's an article I wrote called "When the Lion Kills Your Child" about the heroin epidemic in America. And I took care of 2 kids his age that died of heroin overdoses back to back on a shift, and while my own kid's getting chemotherapy in New York. And I am just terrified every day that my kid is going to die of cancer. And I said, maybe if there's something I can do, maybe I can get out there and make an impact. Maybe I can just start talking to them and tell them, this is coming from a father that almost lost a son, and somebody that has told hundreds of parents their kids have been killed. I just said, enough's enough. People aren't the right people aren't out there doing it. And another thing I've been doing is talking to my colleagues nationally. I've spoke at 2 big national medical organizations recently, and I said the big problem is that we have tens of thousands of ER doctors and nurses out there that think that their sphere of influence ends at the ambulance door, and that couldn't be farther from the truth, and that we need to be out there as healthcare professionals that are in the midst of some of the worst human tragedy, see this on a daily basis, and bring that experience to these college students, tell them, hey, we're here for you. We have the answers. We can fix this problem. We do this every day in America, And let us be part of the solution. Let's team up together and work together to make our college campuses a safer place. And that's why we're doing it. That's why I'm doing it.
I'm so grateful that you're doing that work, honestly, because your voice is important, your words are important, and it's just a really honest look at what's happening all over the country right now. And you're really giving the students the resources they need in order to fix it. And so I'm just grateful that you're out there telling that story in an honest way, because I don't know of anybody else that's having those honest conversations with students. And it's so important that they hear that. And then maybe they're going to think twice on a Tuesday night, on a Wednesday night, when one of these drugs makes an appearance that we talked about.
Yeah, but my discussion is brutal, honest, in your face. And I don't tiptoe around the uncomfortable spots either. So it's not for everybody.
Yeah,
but,
no, I appreciate that. I appreciate that, honestly. Yeah, I agree. So on to some other topics here. I am sure that you've had some excellent meals while living in Indianapolis. I'm positive about that. So what's your favorite restaurant in Indianapolis, and what do you typically order there?
Athens on 86th Street.
All right.
Athens on 86. It's a Greek restaurant not too far from my house. Tina owns the restaurant. She makes this pistachio, which is like a Greek lasagna. It's custardy, it's decadent, it's probably completely full of calories. It's the ultimate comfort food. But you get pistachio, you get some grilled octopus, maybe a shot of ouzo, okay? And you watch the game. It's the best.
That sounds great.
Athens restaurant, that's right.
That sounds great. Next time I'm in Indianapolis, I'm going to head over there. We're going to get some dinner. That sounds great. That sounds really good. So listen, again, thank you so much for everything that you do. I appreciate that. And if anybody out there wants to book Dr. Profeta to speak with your fraternity and sorority community, make sure that you call me at Greek University. My phone number is 516-642-3108, or you can also email me. My email address is bookings@greekuniversity.org. I'm available 24/7. Obviously, Dr. Profeta is working in the emergency room most of the time, so he's not always going to be able to answer your email or phone call. But the good news is that I certainly can, and I can get in touch with him, and we can set that up anytime that you want. So if anybody out there is interested in bringing Dr. Profeta to your campus, we will make that happen. And thank you so much for what you do.
My pleasure.
I can't say that enough. I'm blown away in all of your essays. I'm blown away that you're actually taking the next level to go out and speak directly to the students, that your job doesn't end at the ER, that you want to get out there and prevent it from happening in the first place. So kudos to you, and thank goodness that you're out there.
Thank you. I appreciate it.
Yeah. All right. And to everybody in our audience, make sure that you go back and take a look at some of the old episodes of Fraternity Foodie. There are some other great interviews out there. And thank you so much for joining us. Make sure you share this interview with other people that you think want to hear Dr. Profeta's message. Thanks so much. And we'll see you on the next episode of Fraternity Foodie. Bye for now.